People with autism, it's a really common experience for GP appointments to be enormously stressful. They may be in pain, they need to make an appointment. Then they've got to break their routine to get there, which again is enormously stressful. Then they've got to go and communicate with the receptionist.
Okay, if you just take a seat in the waiting room, I'll call you when he's free.
And they might have to use one of the touch screens. Then they have to sit in a very busy waiting area where there may be lots of flickering lights. That can make them feel incredibly anxious.
So when things go wrong, I think it's largely because there isn't enough time. It's in the middle of a busy surgery, perhaps. Another example might be the waiting room is very busy. It can be a very noisy environment. It can also be a very unpredictable environment. People can come rushing in, requiring attention immediately, and all of that can be very distressing. Sometimes they can't wait, so you have to see them very quickly, even if that's out of turn. Another thing we've used here in the practice is to have people come quite a lot after the end of a session, a surgery session, so we can be sure that they won't wait and we won't be under so much time pressure to finish. So it doesn't really matter if it takes a bit longer. So I've found over the years that actually sometimes it's helpful to go and see people in their own home where they feel safe and confident, and then it's a sort of, it changes the power balance, you know, it's their home, they feel more equally empowered to you, whereas in my space they feel very disempowered sometimes. It can win trust and it can enable you to make a better assessment, and of course everybody is more relaxed in their own home, so it's easier to see people how they are as opposed to how they are when they're tense and worried. Well, you would think we were always aware that people are on the autistic spectrum, but sometimes the first time the diagnosis is suspected is when we see somebody. And so then you have to be very alert to a sense of otherness, difference, a reluctance to get eye contact, a difficulty communicating. Those kind of things are very important to be alert to so that we can step back a minute and say, okay, we need to respond differently to this person.
So, Mr. Bishop, how can I help?
We're taught, and indeed we teach, that we should always use open questions and not ask too many specific things at first. Indeed, we are often suggested to be silent completely at the beginning and just allow the person to speak. But sometimes people on the autistic spectrum may not present their concerns in the same way. They may actually have quite a lot of difficulty describing those or understanding which particular issues we want them to talk about. So it may be necessary to have a more of a checklist approach. Say, do you have pain in your head? Do you have pain in your chest? Those kind of questions, which we would not normally use at the beginning of a consultation.
Well, first of all, you need to make sure that the person understands that you're asking them a question. So you would need to give them your full attention, and you would need to look at them. You would need to speak using very short, clear sentences.
You can use visual cues. Sometimes you can use them on the computer because sometimes people find it very easy to engage with the computer. Some people find that a bit difficult because it's hard to make the connection between the computer and the body. So you need to customise the consultation slightly to enable somebody to actually tell you what they need to say. Carers and chaperones depend on the person. I'm thinking of one patient who lives alone and is independent and, prefers to be independent, and so that isn't really always available. But on the other hand, with younger people, children and young adults, it's quite helpful to have carers present because the carers have a lot to tell you too. And also, it may be possible for them to hear things, then remember things, and then they can tell the person back, and it can be a kind of ongoing process of iterative understanding.
Another common feature of autism is sensory sensitivity, and this means if you're hypersensitive, it means you experience senses very intensely.
Let's have a little look.
If there is a physical examination, this can be a very, very unpleasant experience. Hyposensitivity is where sense is reduced. I know one example of a man who, when he was younger, he fell off his bike, and it wasn't until the next day when the parents noticed lots of bruising on his arm. They took him to hospital, he was x-rayed, and they realised that his bone had been broken, but he hadn't complained of pain.
Touching people is a very important part of our job, and we have to do that in order to gain a proper opinion of what people are suffering from. So it's very important to get permission to touch. You don't always get permission to touch, but you can often have another go at it on another day and build up over a period of time a relationship of trust which will enable that to be possible. There is no template exactly, it's about customisation and getting it right for the individual.
It is nice if it's at all possible to get the same GP to be seen each time, because you get to build up a relationship with them and they get to know Alan and the best way to interact with him. And of course with Alan, it's having somebody the same. The doctor needs to actually say to Alan what they're going to be doing in advance, not just going up, say, for example, and putting a stethoscope on him or putting things down his ears. Preparation is the key in a lot of it, and explanations, taking things slowly.
If you're a doctor or a GP, one word: empathy. Not sympathy, because sympathy can be patronising, but empathy, understanding, and a calm approach. Someone with Asperger's will automatically warm to that, and I think that's quite important.
The GP would try and engage with Thomas. If they don't look him in the eye, if they don't make the question simple, then we get a very poor outcome. He very specifically picks up on moods of the person that is directly dealing with him. And if he's forced to be hurried, he finds it more and more difficult to communicate. And so in a doctor's surgery, when you only have 10 minutes, those moments are very tricky. So I suppose it's about whoever is dealing with him knowing who he is from the beginning, because it's more relevant and more important for him than for any other sort of patient.